hop back and forth as he's getting ready for school. You know what that's about.
All right. I think that's okay. So we're gonna start up. Some other speakers are joining in a few, and we have delegates also will be joining in a few. For the interest of time, I believe if we start up and if they find us continuing, I think that's gonna be of help. Albert, welcome. I know you are ready, Albert. We have Craig, we have Catherine, we have Valentine with us. Dr. Mary is joining in a few together with Onesimus. You will allow me to start because I know our technical have already initiated recording, so I don't have otherwise but to start up for the day. So we had a very interesting song here, but unfortunately, I don't think if we are going to play it because of time. So sorry for that. Kevin, allow me now just to start up because of time. Good afternoon, good evening, good morning of distinguished directors and esteemed policy leaders and dedicated teachers, valued parents, funders and strategic leaders who are present in this roundtable. I welcome you all on behalf of Coalition for Digital Education Wellness. And the coalition was founded by Youth Initiative Development Program. And today we are here not just to debate, but we are here for an important engagement. We have experts in this room that really represent the critical need to solve one of the most urgent threats to our collective future. I normally call it the digital paradox. This is really the technological tools accelerating our children's potential and are simultaneously eroding the mental and physical foundation necessary to sustain it. So our foundational event that we did this year in April, that is Digital Education Wellness Symposium at Golden Tulip, confirmed what many of us have experienced firsthand. The report is clear and the threat is no longer theoretical. It is systematic and economic, and I'll say it's also urgent. So I'll talk about the first report. There was the finding on the crisis of the screen cycle. So the DEW's 2025 report exposed the destructive loop on screen-to-screen fatigue, in the sense that we noticed that we have a lot of challenge in terms of on how we regulate our children, on how we regulate our staff, on the number of time they can spend on their screen. And if I'll mention what came out in school, we find, well, when our children are at home, so you find parents will enable, they will spend most of their time on the screen doing an assignment. But again, after that, they will ask their parent for a phone or any other gadget to do maybe online gaming. So in the sense of taking a break. So that to us is not taking a break because it is from screen to screen. And that may lead to a lot that we are going to discuss today. And it will also enable me to name it digital junk that our young people are consuming. And this really destroying their long-term health. And we are creating a generation that is always on, that is always on, but never truly present. And the second outcome was on NCDs and mental health nexus. And the data is alarming, and I know we have experts, good speakers who are going to share with us the insights according to the WHO, what is happening on the ground. So there is passive sedentary lifestyle enabled by digital saturation is fueling a lot of NCDs, preventable NCDs. We are witnessing, I'll mention most of the cases that we normally meet in whenever we do our sports program is obesity rates rising. We have a lot of obesity rising, and there is documented surge in youth. There is documented surge in youth and youth anxiety and depression, directly correlated with the time we spent on our screen, and it is unregulated, I'll say unregulated online environments. So the third finding, according to my report, is our report also highlights a profound crisis on accountability. We noted that technology is often designed for addiction, maximizing engagement for profit, while our policies lag years behind, leaving young minds vulnerable to misinformation, cyberbullying, sorry. So there is term that I am looking, but let me just say the manipulation. These policy vacuums must end. And part two that I will want to talk about is why should this concern our tech funders, directors, and human resource departments, assurance leaders? Because this crisis is not just a social issue, it is a catastrophic economic risk for human capital. I want you to ask yourself, if you are a human resource or you are a teacher, what is the long-term ROI of talent that thrives brilliantly for 5 years, only to spend the next 50 fighting health issues accelerated by the very technology we have mastered, or your team have really mastered? We are investing into education and innovation only to watch our highly skilled individuals, our future workforce, our entrepreneurs face burnout, chronic illness, lost productivity. The World Economic Forum projected the global NCD burden to exceed $47 trillion by 2030. So to mean every hour of unregulated screen time today translate directly into a drain on corporate profit and also a national healthcare budget tomorrow. So good digital habits are no longer a perk. They are the critical infrastructure for economic sustainability. We must stop this trend of allowing people to spend the money they earn fighting diseases they acquire digitally. So today we move to authoritative action. Our goal today is to finalize the strategy that will guide the CODU action plan and also define our 2026 summit that we are planning. And we welcome you all to be part of it. We have assembled the best minds, including we have Daktari with us, Dr. Catherine Karekezi from the NCD Alliance Kenya. And we have Craig Delage and also Mary Akabe from Zenith Global. They will address these strategic imperatives, starting from the policy, and then we are going to ethical design. Then again, we will delve into the local solutions that we already have. So to conclude, the Coalition for Digital Education is the unified front against the digital paradox. We are asking you and our esteemed partners to use this season or session to commit your expertise, your organization resources, and your influence. We invite you to join the Coalition for Digital Education, Wellness, and invest strategically. Let us commit to building a resilient talent, a talent that will not only thrive in the digital age, but will possess the mental and physical health to sustain the success of decades. So let us transition from the policy paralysis to decisive action. Thank you so much. And at this particular time, I would like to invite Valentine, our moderator, to take it through. Valentine, over to you.
Okay. Thank you so much for that, Collins, and giving a very good analysis of the report. So very interesting to hear you mention about the digital paradox, the digital saturation, and how we are having destructive screen fatigue. And I like that you mentioned about the accountability we should have. It should be engaged. It should be something that is benefiting the community, benefiting us even in our own homes. It's not about engagement for profit. So I'm really excited to hear from the experts over here. And the first thing we will do is just have a round of introductions of the speakers and just give just an introduction of yourself, your specialty, and then after everyone introduces themselves, we will go right into the questions. So I'll just call out Craig. Let's start with you for your very brief introduction.
Yeah, thank you very much. It's good to be here. So I'm Craig DeLarge. I'm from Philadelphia, Pennsylvania, in the United States. I'm a digital mental health strategist, researcher, and educator. My work is done in Wise Working Leadership. That's my consulting firm. And my work is really focused on helping a greater number of citizens to understand how to use their digital lifestyles to support their wellness. And this is the topic that I'll be talking about today. So it's really good to be here. Looking forward to a good engagement over the next 90 minutes. Thank you again, Valentin.
Thank you for that very comprehensive introduction. Looking forward to hear more on that. And we can just move to Mary. Mary, are you here? Okay, as we wait for her to join, let's move to Albert. Let's see, is Albert here? Okay, as we just wait for them to possibly unmute themselves, we'll just have Catherine introduce herself. I know she's here. Catherine, over to you. Dr. Catherine.
Hi, thanks, Valentine. Good afternoon, everyone. Dr. Catherine Karekezi, Executive Director, Non-Communicable Diseases Alliance of Kenya. By way of introduction, I'm a pharmacist by training, but with a PhD specialization in medicinal chemistry. And I've worked across from research, academia. Now, obviously, I'm working in the NGO field and public health. And yes, I have contributed to policy development, of course, in academia, to training, and to different aspects of pharmacy, and now to different aspects of public health with a focus on non-communicable diseases. I am also part of the East Africa NCD Alliance of East Africa, and as well as our founder member of Kenya Diabetes Management and Information Center. But I'll give a bit more introduction about the NCD Alliance once we start the presentation. Thank you very much.
Great, thanks for that great overview, Catherine. And perhaps has Mary, Albert, or Onesimus joined? Collins, if you can let me know, or perhaps we should just dive right into it.
We should just dive right into it as we wait for them.
Okay. Okay, great. So I really liked, Craig, how you introduced yourself, saying that you help citizens to use digital wellness, just to support their lifestyle. And just based on that background, And given how the current digital platforms are often designed to optimize for addiction, directly undermining both mental health and NCD prevention, if you can just tell us, for example, for this Coalition for Digital Education Wellness, what are the two compulsory ethical design interventions that will effectively shape a digital lifestyle for wellness? Just
Yeah.
perhaps two or even more, according to your expertise.
Thank you for that question. So you're absolutely correct. And Collins mentioned this earlier that these technologies that we're using have been, well, let's say they were initially developed by technologists for the purposes of providing benefit to society and to individuals. What typically happens with any technology, though, is we get into this dilemma that we're talking about, that the technology is a tool. It's like a hammer. It doesn't, you can break a window with it or you can build a house. It doesn't care what you do with it. But by default, as human beings, we tend to break more windows than building houses when we are early in the use of any technology. And this is not just digital technology. This is, storytelling, cars, tobacco, right? Alcohol. All of these things have beneficial use, but we somehow end up hurting ourselves with these various technologies. So what that then means is that in order for us to benefit and stay well, we have to be deliberate, skillful, um, mindful, and disciplined, and in community in how we use these technologies so that we use the technologies to stay healthy rather than the technologies using us, leaving us unhealthy, and just enriching lots of corporations. And so I've become very inspired in my own work about how to drive this different discourse or approach or way of thinking about the technology. The algorithms and the various methods that have been designed into these technologies, again, if they're used mindfully and minimally, can benefit us. But no one is going to give us the education to stay well when they can make money. It is our responsibility as citizens, as communities, as professionals, as leaders to to educate ourselves and then to model for others what is a healthy use of technology. And that's what we're here to work on today. And then when we relate this to non-communicable diseases, we can see or kind of make the connection between non-communicable diseases, diabetes, hypertension, depression, and how they exasperate and contribute to a worsening of these diseases when we are unskillfully using them. But I'm going to show some examples when I do my talk a little later, that if we use these technologies appropriately, they actually can lead to a reduction and a lessening in the prevalence of these same non-communicable diseases. So thank you for asking, Valentin. I hope that was a helpful answer.
Yes, that's very helpful, especially the aspect of being deliberate, being skillful, mindful, and working in community. And especially just sort of like a follow-up to what you've said, in terms of community, how do you really see that working now when we actually go to the ground? How do we actually do this implementation, just in a high level way?
Yeah, so we can describe community in two forms. There's toxic community and there's tonic or therapeutic community. One poisons us, the other heals us. Once again, let's take social media for instance. It's just a hammer. Social media, when used skillfully, can facilitate my finding people who have common purpose and cause in life, who are working to solve common problems, and can create the ability for us to educate and practice together. But again, if I'm not being mindful and skillful, if I'm not working within the appropriate community, that same technology, as we see all around us, can be the source of distress, of addiction, of disconnection, and ultimately of violence, whether we're talking about homicide or suicide. We have the power and the agency and the ability as individuals and communities to recapture a better purpose for these technologies. So using technologies like Zoom, finding people on Facebook and LinkedIn who again are working on solving common problems, dealing with common issues in our communities, and then using that social media as the basis for education and outreach and modeling so that we come together in order to be well versus sick or ill. This is the potential of these technologies. And by the way, even though you don't hear a lot about it in the news, you can find very many examples of how people are using the technology in this way. But again, we as human beings tend to do more of what we hear more of. And we've got to get the word out and the practices out about how the people are already using these technologies beneficially for wellness so that we can do more and more of it, and especially for our children and our grandchildren. So thank you for asking.
Amazing. So it's all about being mindful, especially in terms of the community. Definitely don't go to the toxic community. Uh, do the therapeutic one. Okay, amazing. So I would just like to hand over to Dr. Catherine, and this will be a good opportunity for you to tell us more about NCD Alliance Kenya, and then also about the East Africa NCD Alliance, and especially what you're doing in this space in terms of policy on all things about NCDs.
Yeah, so thank you very much, Valentine. I'd just like to firstly just do a presentation, and I will talk about the NCD Alliance as I move over. So if I can have the next slide. This is just an outline of what I intend to speak about this afternoon. So just a brief introduction, firstly about the Alliance and also about digital health, talk about non-communicable diseases, the burden, the NCD risk factors, and then issues of digital overload and NCDs, finalizing with prevention, and lastly, a conclusion. If I can have the next slide, please. So basically, the NCD Alliance of Kenya is a national umbrella body of different organizations working in the area of non-communicable diseases, specifically focusing on prevention as well as control, and also the care and rehabilitation of persons living with or at risk of developing NCDs. We are registered as a non-governmental organizations, now known as a public benefit organization, and we have in excess of 60 members. We have a vision of NCD-free Kenya, and we strive to be the lead organization of NCDs across the continuum of care. So we do work mainly on advocacy, and this is mainly driven by meaningful involvement of people with different NCDs, health system strengthening, research, and knowledge management. And maybe just to talk a bit, we are also members of the NCD Alliance of East Africa, which encompasses, now it's 8 countries, Uganda, Rwanda, Burundi, Tanzania, Zambia, recently added DRC, South Sudan, and I think Somalia is also coming on board. So are we actually 9 now, including Kenya. So that is the NCD Alliance of Kenya, the NCD, East Africa NCD Alliance. We also work with the Africa NCD Network, and we're also members of the Global NCD Alliance. So that is where we fit, both locally and also internationally. And just to mention that we do serve as an implementing partner for the Ministry of Health in many of the programs which are implemented by the Ministry of Health. We also co-chair the NCD Interagency Coordinating Committee with the Ministry of Health, And this is an agency which, a committee which basically strives to bring on board the non-health sector for them to also participate in NCD prevention and control, essentially a more government, whole of government type of approach. Maybe just now to move on to the specific topic that you asked me to speak about. This is just a basic introduction. The fact that the world today, the presence of technology is ubiquitous. It's everywhere, all around us. Then there's a concept of digital well-being and how the internet and technology would make us feel. And then the aspect of the online impact on mental health, physical health, as well as emotional health. And as Craig has already mentioned, technology should enable us and not negatively affect our lives. So some of the negative experiences which will impact on digital well-being, impact of self and self-image, friendships and relationships, the view of the wider world, and then again, issues, factors which may contribute to this will be some of the digital drama that is portrayed through social media, the desire to fit in, distressing content, as well as a screen time and healthy balance. So if we can move on to the next slide, please. Just to give you a basic background or overview about NCDs, which are responsible for 74% of the deaths annually. This is about 41 million deaths. Focusing on Africa, increase in the NCD burden. And actually, if you consider the deaths due to NCDs, Africa and low and middle income countries actually account for the bulk of the burden of deaths due to NCDs. So in Africa, we've had a rapid population growth and urbanization. So with associated lifestyle changes, for example, reduced physical activity, increased consumption of unhealthy foods. These are some of the issues which are fueling NCDs. Then there's also the aspect of socioeconomic disparities, mainly affecting people from lower socioeconomic backgrounds. This again limits their access to nutritious foods and healthcare services and increases their susceptibility to diabetes and related non-communicable diseases. There's also the coexistence of infectious diseases, for example, TB and HIV, and these are associated with the development of NCDs. Again, there's an aspect of limited resources and access to healthcare. Of course, today we're talking about the digital overload and what is the impact of this on non-communicable diseases. Looking at the burden of NCDs in Kenya, NCDs account for about 42% of all the deaths in Kenya, more than basically at least 50% of hospital admissions are due to non-communicable diseases, and up to 55% of hospital deaths are attributed to NCDs. Important for us to remember that NCDs reduce household income by approximately 30%. The pie chart just shows you the distribution of NCDs in Kenya, with cardiovascular diseases accounting for the bulk of the deaths due to NCDs, followed by cancer, chronic respiratory conditions, diabetes, and then the other NCDs, which would include things like sickle cell disease, dementia, and so on. We can move on to the next. This is just a schematic showing NCDs and their risk factors. The major NCDs, or the main NCDs which have been prioritized by WHO: cardiovascular diseases, chronic respiratory diseases, cancer, diabetes, and lastly, mental and neurological conditions. But this does not mean that these are the only non-communicable diseases. In terms of the risk factors, these are behavioral risk factors and healthy diets, the use of tobacco, and now the use of nicotine, as we shall discuss. I know this talks about harmful use of alcohol, but now it's really just the use of alcohol, physical inactivity, and air pollution, which is a major driver of NCDs, especially cardiovascular disease and so on. Next slide, please. This is really just the same kind of schematic. just showing you the factors which are causing the increase in NCDs. Firstly, urbanization, globalization, and social cultural factors. These are impacting on behavioral factors. Behavioral factors are those factors that you have some control over. The use of alcohol, tobacco, unhealthy diets, physical inactivity, issues of stress, and lastly, air pollution. We also need to recognize that there are other factors which are contributing, aspects which you really cannot control, issues of aging, family history in terms of the genetics. These also have an impact on the increase in NCDs. So essentially, both the behavioral risk factors and these other non-modifiable risk factors influence physiological factors. For example, overweight and obesity, increase in blood pressure, increase in blood glucose, increase in cholesterol, and these are the ones which are the major drivers of cardiovascular diseases, diabetes, cancer, and so on. Moving on to the next slide. This is just a scheme showing in terms of the obesity rates, for example, 45% in women of reproductive age, up to about 21% of adult men are obese. Diabetes, about 7.3% of adult women, 7% in adult men. Hypertension, about 27% of adult women, and about 27% again in adult male. This is from the KDHS of 2022. Next slide, please. So let's talk about the aspects of sedentary behavior. Obviously, I think there's a picture there, but hasn't come through. Just very important for us to remember about issues of the energy balance. As we know, there is a big, the body has mechanisms to ensure that it maintains balance. So in this case, energy input should be equal to energy output. But in terms of sedentary behavior, where we are basically not active physically, we find that the energy input is way in excess of energy output. And this is what is fueling overweight and obesity. It also has an impact on mental health. Next slide, please. Moving on to aspects of tobacco, alcohol, and nicotine use. The challenges that we are facing at the moment are issues of marketing techniques, basically using social media and other digital forums to promote alcohol, tobacco, and nicotine. And essentially, at the moment, these are more or less, at least in our country, unregulated. And then again, the issue of access, issues of online marketing and sales, online, you can order your alcohol online, it will be delivered to your house. You can order your tobacco and even your fast foods to the house. So basically, these are risk factors for diabetes, cancer, cardiovascular diseases, mental health, and so on. Again, we need to recognize the advent of the novel nicotine products and the smokeless tobacco products. These are currently being marketed, yes, physically in the stores, but also online. And this is actually unregulated, at least in our country at the moment. And also the fact that they are also especially the nicotine products, are being marketed as safe alternatives to tobacco. And again, if you look at the marketing strategies, these are mainly targeted at children and young people, adolescents. It's also important for us to remember that nicotine is addictive, and it is also a risk factor for NCDs. And also important for us to remember that tobacco is an entry point to other substances of abuse. And lastly, even the digital marketing of alcohol. And WHO has now come out to say that no amount of alcohol is beneficial to health. Next slide, please. What about obesity? Basically, the issue of unhealthy foods and sugar-sweetened beverages, which are being marketed, especially being available on social media and through digital platforms. Essentially, unhealthy foods are those foods which are high in salt, sugars, and fats. And again, here we need to consider the energy balance, energy input equal to energy output. But in the case of especially these unhealthy food products and the rate at which we are consuming them, we are finding that the energy input is way in excess of the energy output and therefore fueling overweight and obesity. So we're also the aspect of digital marketing of sugar-sweetened beverages and other foods which are high in salts and fat. Next slide, please. What about digital well-being and sleep? And this is especially important for children and adolescents. Our sleep is often overlooked as an NCD risk factor. And it is important for us to remember that sleep is affected by and also affects non-communicable diseases. Insufficient and/or mistimed sleep is a risk factor for obesity and NCDs. For example, hypertension, cardiovascular diseases, and type 2 diabetes. We also need to remember there is a recommended sleep duration of 7 to 8 hours for optimal physiological function and optimal functioning of our bodies. Short sleep duration of less than 6 hours has been associated with the onset of different types of NCDs, is a risk factor for NCDs. What is the problem with digital and electronic devices and sleep? As we all know, sleep is essential for mental and physical well-being, but it's been shown that the electronic devices, especially being used at night, impact on sleep behavior, basically impact on the quality of sleep and sleep deprivation. And it's now known that short wavelength light, which is emitted by these devices, suppresses melatonin secretion, and melatonin is associated with the sleep patterns. They also cause increased stimulation, and this is both mental, physical, and emotional stimulation, essentially disrupting the sleep patterns and onset of sleep. And basically, we end up with irregular sleep-wake patterns. And obviously, you're not getting the requisite duration of sleep, which is beneficial for your health. What about mental health? There's aspect of misinformation, an unrealistic self and worldview, the issues of cyberbullying, which we have already mentioned, and mental health. It's important for us to remember that mental health disorders or mental ill health tend to onset is actually during adolescence and young adulthood. We've already spoken about the aspect of suicide, which is one of the leading causes of death in youth. And it has been shown that addictive screen use is linked to youth suicide. Just a quote from one of the papers: adolescents exhibiting high addictive use behavior with social media, mobile phones, or video games face roughly double the risk of suicidal behavior, as well as symptoms of anxiety, depression, aggression, or rule breaking. So just to finalize, a couple of slides. Just to talk about NCD risk factor prevention. NCDs are linked to systematic factors that shape people's lives. Both social, commercial, and physical environments will limit people's ability to make healthy choices. Social and economic inequalities are currently fueling the burden of NCDs, and essentially poverty, gender inequality, poor access to healthcare, poor urban planning, commercial determinants, for example, food systems and marketing, are also fueling the burden of NCDs. So in order for us to prevent NCDs, we need to create environments that support health-promoting behaviors and limit exposure to the risk factors. Next slide, please. So just in conclusion, we need to promote, especially in the topic we're discussing today in terms of social media use and digital use and well-being, we need to promote awareness of the hidden health risks of technology for example, in schools and other community forums. As already been mentioned, we need to limit screen time, especially the nocturnal use. We also need to have enact policies to regulate online promotion, marketing, and sale of alcohol, tobacco, nicotine, and healthy foods, especially to adults and children. We also need policies which will limit or regulate digital technology use, especially for children and adolescents. Just to finish, we need, obviously, if we are able to prevent, we need to choose tomorrow's health today by adopting healthy behaviors today for a healthy tomorrow and future generation. So let us protect present and future generations by preventing NCDs and preventing their risk factors. I have a final slide just to mention that Australia passed their social media bill yesterday. And basically, Australia has brought in a law to ban social media for children under 16, starting December 10th, 2025. This is a landmark law which aims to safeguard young minds from online dangers. A recent survey reveals significant exposure of harmful content, cyberbullying, and online harassment among Australian youth. The government believes this measure is crucial for their mental health and safety. So I believe Australia has set the ball rolling. So let us see what we in Kenya and in Africa and the rest of the world can do to protect our youth and our children and the future generations. So I'd like to thank everyone for your attention and for the invitation to speak today. And the last slide. Yeah, so thank you very much. And I look forward to the discussion. Sorry, Valentine, I can't hear you.
Valentine, are you there? You are on mute, please.
Okay. Okay, am I audible now? I wasn't able to unmute myself.
Yeah, we can hear you now.
Okay, sorry for that. Okay, thank you so much, Dr. Catherine, for that really wonderful presentation over there. Very interesting to learn about the Australia social media ban, and perhaps a quick follow-up on that. What would it take for perhaps even East African countries to get there? So, for example, like for Australia, how long did it take from the policy development, public participation perhaps, to actually now being a bill? How would that be transferable over here?
I'm not sure exactly how long it has taken, but I know Australia started discussing these issues soon after COVID or even during COVID. Because remember, during COVID, there was a lot of screen time and very little physical inactivity because of the lockdowns. And I think it's taken quite a number of years to get there.
Okay, that's really good. I think it's a really good way to, to protect the youth, given even the quite alarming numbers that you've given, that NCDs are causing 42% of the deaths, even 50% of hospital admissions being due to NCDs. So a very timely presentation over there. So I will go to Craig. You mentioned there is a presentation or video that you have to make, and then also perhaps if the other speakers are also here, I'll go to them after you.
Okay, so
Craig.
I'm going to share my slides. By the way, to the question that was just on the floor about the Australia law, I did a quick AI search, and presuming that it's not hallucinating, they got that law into their parliament and passed in 1 year. Okay. So, when we sit back and we say, well, we need change, but it's going to take forever, not when there's political will, not when there's community, not when we build the right case for wellness and for health. And of course, we always have to have an economic case there also. But let's let that encourage us. If the Australians can do it in a year, there's no reason why countries in Africa can't do the same thing. All righty. Okay, let me get my slides up here. Okay. Oh no, I'm showing the wrong things. Hold on, you guys. I'm going to get this correct, and it won't take long either. Um, okay, let me close this. Okay, here we are. Here we are. Alrighty, so it's really good to be with you today. I'm appreciative for this invitation to speak. This topic that I'm going to talk about today of technology-enabled wellness is one that I can talk about all day long. And in some respects, I do, between talking to people about it, advising companies on it, um, doing podcasts and webinars and this sort of thing. So let me be succinct here. Um, Today, we're going to talk about these four things. What is tech-enabled wellness? What is a digital lifestyle? I'm going to tell you some quick, succinct stories about my own practice when it comes to technology-enabled wellness. And then I've got some calls to action that we could all follow up on. So, a bit more about my background. So, let me say this. My friends in Africa always say to me, Craig, you Americans, you only talk about work. When you introduce yourself, introduce yourself. So I should tell you, I am a husband of 37 years. I'm a father of two children, 42 and 36 years old. I'm the grandfather of a 10-year-old son. I spent 30 years in life sciences digital health, working for big companies like Johnson& Johnson, Takeda, Merck, Novo Nordisk, both in the United States and in Asia, in Singapore. And today in my consultancy, I do lots of advising around commercial strategy for companies in the digital mental health space. As a function of a mental health emergency in my family 19 years ago, for the last 19 years, I have been a mental health advocate, board member, and educator. So just understand that this work that I'm doing around digital mental health is bringing together 50 years of experience in my past life. In my work, I am really out to help us to grapple with what we call the Promethean dilemma. I mentioned this a bit earlier. Whenever we get a technology, and a technology is like fire, Prometheus, the Greek titan, gave fire to human beings. The reason that the gods did not want human beings to have fire is because they know that when we get fire, we burn down the house. We abuse ourselves and each other with technologies if we don't use it skillfully and mindfully. The question is, with these digital technologies, can we get better and better at cooking dinner? That's what you're supposed to do with fire, right? Cook dinner, but not burn down the house. None of us would say, well, because fire can burn down the house, let's ban fire and never use fire. No, what we say is, let's study fire. Let's understand its properties. Let's put it in an appropriate container. Let's keep a fire extinguisher nearby. Let's have a fire department. Let's have regulations and laws and an understanding that allows us to use the fire in a way that is safe. We cook dinner, but we don't burn down the house or the neighborhood for that matter. If we're going to manage this dilemma properly, we need skill and literacy to use technology in a way that we benefit, but we limit its harms. So, when I talk about technology enabled wellness, fundamentally what I'm talking about are all the ways that we have an opportunity to use the digital technologies that we're already using every day. And this now backs up what Dr. Catherine talked about to sleep better, move more, eat well, relax, and cultivate therapeutic versus toxic relationships. Dr. Catherine already talked about the idea that pretty much all of the non-communicable diseases are growing in their prevalence because of a lack of practice in these 5 areas. And the way we use technology today, it's only making it worse. The question here is, how can we turn the corner and use the same technology? This isn't about new technology or more technology or different technology. It's about the technology that we already have and how do we use it to be more well and begin to reduce the rates of non-communicable diseases. Now, appreciate all technologies have the opportunity to support us in 4 ways. We use technologies to educate ourselves and to get access to information more quickly and conveniently than ever before. The question is, what education are we engaging in? When we get that education, we then use the technology to practice, to do something with it, not just know something about it. We then further use technology to create social support. And this is critical because human beings are almost unable to make any significant change in themselves outside of community. We are social beings. And then finally, we use technologies to track our behaviors because the nature of change in human beings is we take 2 steps forward and 1 step back. We make a commitment to do something and then we get exhausted and decide not to do it. So if we are not continually recommitting to better wellness practice, the fact is we're going to be unwell. Now, when I talk about a digital lifestyle, understand that every one of us have a digital lifestyle, but few of us think deliberately about it. Your digital lifestyle is the combination of devices, channels, and content that you use day in and day out whenever you're using digital technology. This slide that I put up here is intended to help you to more quickly contextualize what I mean. You can look at this list right here, and you can pick out for yourself the top 1 or 2 devices that you use most often in a week, the 1 or 2 channels that you use most often, and the type of content that you tend to use. And by the way, I want to make this deck available to everyone. And if you scan the QR code in the bottom right-hand corner, you'll actually get a landing page where you'll be able to download an ebook that I've written about digital lifestyles. So I hope you'll do that to further educate yourself. But again, you can see from looking at this chart that this is all around us every day, and it's not going away. Nor should it go away, because these are all tools that are beneficial if we use them that way, that can make us well if we use them that way. So I want you to be thinking about, what is your current digital lifestyle? Again, not new technology, not more expense, not an additional anything, but understand what you're already doing and using it for wellness. Now, appreciate that when we use our digital lifestyles pointed towards wellness, and this again is backing up something that Dr. Catherine said, we can produce a life that is full of these practices. We get 7+ hours of sleep at night, and we get naps during the day when necessary. We get 150 minutes or more of moderate movement weekly. And that, by the way, is the US government's standard for what healthy movement is, 150 minutes a week. We have moderate plant-based diets, and we are well hydrated. I don't know if any of you realize it, but on a daily basis, you should drink half your body weight in ounces. And I forget what the metric is, forgive me there, whatever the metric equivalent of an ounce is. Whatever your body weight is, you should be drinking half of that in water every day. That's what good hydration is. And yes, hydration is attributable to exasperation of non-communicable diseases. Further, we should be able to better regulate our emotions so that we are less distressed, we are less prone to violence. whether that's physical violence or verbal violence, we will be able to better cultivate therapeutic, tonic community and relationships versus toxic and violent and detrimental relationships. And understand that when all of these things come together in our lives, and they can be enabled by technologies, we are then in a position to begin to lower and to continue to lower the prevalence of non-communicable diseases. Now, very quickly here, 4 ways that I use technology in my own life to stay well. Okay. I have a Fitbit. It helps me to monitor my sleep and my movement. And I find it very beneficial because it gives me longitudinal data and it helps me to see when I'm becoming lazy, which I do. I become lazy. I want to do those steps. I want to get that sleep, but I fall off. But measurement tells me, Craig, recommit. Insight timer, which I use for my relaxation and meditation practice, for my yoga and calisthenic movement practice. Lose it, which I use to track my meals. So I understand what level of calories am I consuming? What level of nutrient am I getting in my food? And it's been very instrumental in helping me to regulate my weight. And all the more as I get older. I'm not a young man anymore. I'm 59, about to be 60. I told you I'm a grandfather. And then, yes, I've been experimenting with artificial intelligence tools like the BAI microphone that listens to conversations that I have with my family members and then helps me to be better at how I communicate so that I can communicate in a less exasperated, more patient, more compassionate, more complimentary manner. I've got lots of poor habits around communication that I inherited from my family, I'm afraid, but I'm always trying to get better. And this is an example of how I'm using the technology to do that. Now, technology will harm us if we are not working at reducing its harms. So here's a couple recommendations. Practice digital minimalism. Cal Newport wrote a really good book about this. He says that occasionally you need to do a digital detox, which is to say, put the technology down for 15 to 30 days outside of your need to use it to make your living. I understand we all got bills to pay. So we're not saying get fired from your job, but there's a lot of use of digital outside of my need to make my living. And it's good to back away. Now, what do I need to do when I take a detox? I need to fill that space with purposeful leisure, reading books, going to coffees with friends, painting, drawing. You see my point. The things that we used to do before we had these smartphones to fill our time. And then I need to study how the technologies have been designed to use me rather than me using the technology. Then we know in particular that when it comes to artificial intelligence, AI is eroding our capacity to think. Now, that doesn't mean don't use AI, but it does mean that if I'm going to use it, I need to also pay attention to engaging in debate and critical thinking. I need to study philosophy because it challenges the mind. I need to engage in creative problem solving and object making. Here's the analogy I'd like to give you. When you get a car, cars have damaged our ability to move, and that has resulted in increased cardiovascular, diabetes. Dr. Catherine talked about it when she talked about sedentary lifestyles. So it doesn't mean that I shouldn't buy a car, but it means that when I buy a car, I have to be very mindful and deliberate about planning how I'm going to move while I have a car. Well, with AI, we have to plan how we're going to move our minds so that that AI does not cause us to get various degrees of mental and cognitive diabetes, is what I'll call it, or metabolic syndrome. I hope that makes sense. So let me wrap up here. I hope I'm not going on too long. Some calls to action. Thoughtfully identify your digital lifestyle. Be knowledgeable and mindful about it. Then think about what are the gaps in your 5 pillars of health? Where do you need to sleep better, move more, eat better, hydrate better, relax better, develop better therapeutic community? Then I invite you to identify and play. Play is the key word here. Okay? Play with 1 to 2 tech enabled wellness experiments over the next 12 weeks. Do it in community. So adopt accountability partners. Because trust me, you have friends and family who also need to sleep better, move more, eat better, relax better, have better relationship. Expect to have a fall off, but be committed to recommitting. And then please scan the QR code and get a copy of our digital lifestyles ebook. So I'll wrap up with that. Thank you again for the time. Happy to take any questions that anyone has. Valentin,
Thank you
back to you.
for that. Thank you so much for that, Craig. I really like the analogy you gave and even showing us the apps that you're using. So I've quickly checked out that Lose It app and I've seen it has a free version. So it's something I'll be looking up. And also the QR code over here, I will encourage people to scan. Looks like a very nice way to know your digital lifestyle. We should all just learn how to have that digital detox, have that digital minimalism. So thank you for that, Craig. And I think I've seen Mary, one of our speakers over here. Is that correct, Collins?
Yes.
Okay. Hi there. Welcome. And you can just briefly introduce yourself.
Right. Thank you very much. I'm going to borrow a leaf from Craig, and I'm happy he said that because even in my resume, I put it there that I'm a mother of 2 young men, especially because they always remind me that they are no longer children. And recently, last month, I became a grandmother. So I'm the president, CEO, Zen Global Health. My specialty is minimally invasive surgery and robotics. So I'm a healthcare practitioner, and also what we do as Zen is to bridge the global South-North divide through collaboration, partnership, and foster global health equity. So this is something that is really something that after my heart that I love to do, especially with the youth and with the burden of NCDs as well. So can I just introduce myself or carry on with the session?
Yes, perhaps did you have a presentation like a PowerPoint or?
No PowerPoint.
Okay, so I can just go to your question and then you can just merge that with perhaps what Zenith Global Health is doing.
Okay.
Great. Okay, so as we've heard even from our previous speakers, the NCD burden is rising globally, in Africa and even now closer home to Kenya. Given all the sedentary behaviors and poor dietary habits that we have. So specifically for you, how critically must national health systems and policymakers adapt their existing NCD prevention budgets and strategies to address the digital contagion? We've heard of people are addicted to their screens. So what can we do from a government and even a global national health system perspective? Over to you, Mary.
Oh, thank you very much. Yeah. So I was going to start with the statistics, but I know there's a lot of statistics done already. So I'm just going to pinpoint something before I go into my presentation. And that is the 82% of premature NCD deaths occur in low, medium income countries. Top contributors on heavy diet, tobacco, alcohol, physical inactivity, and air pollution. I believe that we need to be a bit more explicit. We can assume that physical inactivity will include the digital contagion, but not many people will actually interpret it that way. It will be interpreted like we've always known it. And incidentally, the people that we're going to approach, our lawmakers, policymakers, will not be looking between the lines to, actually deduce that we are talking about digital contagion. So I believe that we need to be a bit more explicit, especially when we think about the implications of, having a sedentary life on these NCDs, which excessive screen use is part of it. Right. One of the things I've read about obesity risk, diabetes, cardiovascular diseases, and things like that. Now, some of our adolescents, they spend up to 8 to 10 hours on screens, which actually is over the recommendation by WHO. This is something else why I said we have to be explicit. Although the WHO has something in place, but how are we implementing it? How are we incorporating it into either into law or to actually enforce it, to make sure that this is utilized, embraced, and also enforced? There's a global prevalence of what's going on, especially amongst our youth, because they are like sponge at that age. For us, some of us have to go out of our way to learn these things because of work requirements. I remember my youngest son, he's 27 now. He was in primary school when he was helping me with my PowerPoint some 20-something years ago. And the brother actually showed me how to insert the floppy disk. They were both in primary school. So you can imagine, and he's 31 now. So you can imagine how early they've been introduced to this and how long it took us to be here now talking about this. So the fixing of it will not come overnight. And on saying that, I believe that we need to redefine advocacy. We have to move from advocacy being lobbying to having empirical knowledge, empirical evidence, and also to involve our youth in this, to involve people with lived experience, people who've had good, bad experiences from technology when, we move forward. That's way the government, we know that we have to have policies in schools, both to include physical activity and digital literacy. As any global health, one of the things we go to schools, we talk to them about choices, their courses when they are in their year 9, maybe a year or two before they leave secondary school, or a year or two before they go to university. So we talk to them, as we give them literacy on technology, we talk to them about everything, like tech for good, how it can be used both to advance and the detrimental aspects of technology as well. Now, when we come to tech responsibility, the industry, just like Craig, I've had the opportunity to work with, the likes of Johnson & Johnson, Medtronic, and people like that. And it's interesting because they want to be compliant. In fact, now, for procurement, for some of these companies, in the NHS, for instance, you have to demonstrate that you are doing something around tech for good, either in education, in mainstream, or either in highlighting what it involves, especially when people are using your product. And we started clinically. Now we're extending it to schools. So those are some of the things you can benchmark in Africa to ensure that, we safeguard our children, we safeguard our youth. We have the political goodwill. We just need to have a way of packaging it and bringing these children along. These are some of the structural risk factors. I don't want to go over what people have spoken about already. National guidelines, school-based intervention, and childcare regulation. We mentioned this in our mental health use session about a few weeks ago. It is important to put these safety points in either all the chat boxes or anything else that our youth are using, either especially with the tech industry. Maybe it will cut off, time off, or a way where when they've been on it, some people use timer, but for adults, we can use timer. Get up every half an hour, move around, stretch your hands and do that. But for our youth, I remember when gaming first started, people were sitting on gaming across the world for 24, 40, 72 hours. Some developed chronic kidney disease, some developed mental health, some died. But because we haven't got the empirical knowledge, or at that time, the empirical, the influence, not knowledge, to showcase, right? To showcase what's happening, like X number of children, and plus, again, let's bring this home to Africa. Sometimes when these things are happening, we always thought it's not going to come to us. We always think it's not going to happen to us. Because to some extent, yes, we have the cultural support of family, friends, we have the obedience aspect of mommy said this to do it, daddy said this to do it. But we should know that this is a totally different generation. Okay? They can say yes, mom, yes, dad. But what they're actually going to do is different from what you perceive they will be doing. So if the policymakers, parents, family guardians, schools, and the tech industries come together to mitigate this, to have policy level solutions, and to enforce. Actually, there are some things in the NHS that if you fail, you get a penalty. Even clinically, if you fail, you get a penalty. And it's structured into the contract before they install anything technological. The other aspect is maintenance and training. We're talking about tech in schools. Teachers, tech people in schools need the support and the training, either for troubleshooting or to actually enforce these things that we want to put in place. I don't know how much I've got, so that I don't go over my time. I'm mindful of the
Yes.
time. Yeah. So
Thanks, Mary.
yeah. Thank you. Of course, awareness, the awareness campaign from grassroots, top. And I always believe that top to bottom approach is great in things like this because it's up and coming, but it's rapidly evolving. Thank you.
Okay, thank you for that, Mary. I like the aspect you've mentioned of moving from advocacy to evidence. We just need to, just stop all these policy developments, just actually have this evidence that we need. And also the aspect of how Zenith Global Health goes to the schools, working with the communities that we're talking about, being bringing the sensitization of tech for good. So very powerful insights over there. And Albert has also joined us. So Albert, I'll just give you the floor for a brief introduction, and then we'll move into your question. And I can see some questions in the chat, so we'll have some time for that. So Albert, over to you. Albert, are you with us, or perhaps he has dropped off? Okay, I think he has dropped off. So
He's
I
on
think this,
mute.
oh, okay.
Let's continue. Maybe you'll join us.
Okay, that's fine. Perhaps there's one question I have seen over here as we are also running short on time. There's Collins, did you see that question? Okay, I've seen the question. I'll just read it out and any of the panelists can tackle it. And then after that, we'll go into sort of the CTA for each of the panelists and then over to Collins perhaps for any other closing comments. So there's a question over here. When it comes to tech-enabled wellness, this is from Rowena Gashewa. When it comes to tech-enabled wellness, where can we draw the line between empowerment and exploitation? And how can we try to counter the misinformation aspect in all this? For instance, use of supplements, which can be a good thing, but now we are finding people overly using supplements even when it lacks proper evidence. Another thing is maybe apps promoting daily mood rewarding, which in turn increases screen time. So I think each of the panelists can just give you a quick one-liner response to that.
Yeah, so I'll jump in and be very succinct. The line is at the observation of effect. If you're observing therapeutic effect, healing, then you know that the technology is being used appropriately. You're across the right side of the line. But if you're observing toxic effect or outcome, then you know that adjustments have to be made. This means that we have to stay continually engaged because we're constantly changing as well as our children, and the technologies are constantly changing. So this is not something where you set a plan and walk away. It's something where you have to stay continually engaged and in community because you can't do it alone. I'll leave it at that.
Thanks for that, Craig. Can we have Catherine? Are you still here with us? Okay, Mary, over to you.
Sorry, what was the question?
Okay, so the question is, let me get it over here. When it comes to tech-enabled wellness, where can we draw the line between empowerment and exploitation? And how can we counter the misinformation aspect of it?
Okay, so the first thing is to be, if I say tech savvy, I don't mean you should be a tech guru. For instance, when Craig was talking, he made reference to some tools and analyzed what they do. Straight away, Valentine, you went to check and you found one. The danger is when you go to TikTok, when you go to Instagram, and you believe what every influencer says to you. Because some of these people, they will promote what they are paid for. The other day, I saw something on Instagram, and I thought, oh, this looks nice, and I was, but into the second minute, it's like, oh, if you want to know more, comment yes, or comment fitness, or comment whatever. I will advise you to stay away from things like that. Stick to what is trusted and tested. And I believe there are websites where you can actually get things that work. Or some of our innovators, they are coming up with amazing things now. Because we do in academic as well as tech education, we work with the industry in signposting startups to the health ministers and things like that, so that they can procure and look into things that are made by Africans for Africans, and at the same time support them when it comes to funding series. So the key part is safety. Safety, trusted products, and yes, they all have their free version. So they are not always on subscription, but it's very important, to make sure that one is safe with the information and not just on, following influencers.
Thanks for that, Mary. The aspect of stick to what is trusted is very true. Always stands the test of time. And I can see Craig has also put in some info for us over there that we can further look at on the chat. So thank you so much for that. And then I'll go back just now to Craig for his closing, sort of the call to action. What is the key takeaway? How do we move from now we are talking here? How do we move it to actually action? the closing, your call to action for all of us here. What do we take to our communities? What do we even implement in our homes with our own children, our brothers, sisters? How do we go about this to start the digital wellness from our own homes and then spread it to the other communities? So over to you, Craig.
Yes, I'll quickly reiterate on what I said in my presentation. So be thoughtful about your digital lifestyle. Be thoughtful about the gaps in your wellness routine. Remember, sleep, movement, diet, hydration, relaxation, relationships. Do experiments. Let your children see you doing experiments. Do experiments with your children as to how you use the technology for wellness versus otherwise. And there's no lack of information on the internet about how to do it. Just Google digital minimalism and you'll find these practices, okay? It's not that we don't have information, it's that we have to engage the information that's available. And then practice, 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 and recommit when practice fails. And with that practice, you'll get better over time. And don't do it by yourself. Don't be like we individualistic Americans. Be like collectivistic Africans. Do it in community, in your churches, in your community organizations, in your tribal gatherings. Make this a part of the culture. We're in the digital age, so we need a digital culture within our communities that makes us healthy. But if we don't do that, it's going to kill us. And we can see that all around us. But we are not powerless in the face of this. I'll leave it at that, Valentin.
Amazing. We are not powerless in this
We are not.
digital age. Yeah. So we need that digital culture. I also like what you had mentioned earlier about we need to learn how to cook the dinner without burning down the house. So now the aspect of being thoughtful, doing the experiment, and as you had earlier mentioned about, the sleep, the move, diet, relax. So really great insights over there for us to take away. So over to you now, Mary.
Yeah, thank you so much. Two things I'm going to talk about is the accountability by technology industry for healthy engagement models, and also international cooperation. And this is to our policymakers and our government. When the policies are being formed, there are organizations, and I mentioned this in our previous session actually, there are organizations who are happy to support in the co-designing of safe technological products to help our youth to fight this fight against digital contagion and NCDs. So then they will need to develop cross-country frameworks to start with so that they can safeguard children from screen addiction and then integrate digital health into public health strategies. And also, as Africans as a whole, we have to now learn to embrace cooperation rather than working in silos. And also to not see each other as competitors, but collaborators. Because some parts of Africa are really advanced in these things. In youth NCD prevention through digital contagion, in youth digital products, in other products that have been designed and supported through international cooperation. And the information is there. We just need to make the move. We just need to know to talk to each other and know that if Kenya is doing this, how can Nigeria speak to maybe an organization or policymakers? And always, I'm a fan of bottom to top approach, because as we are sitting here now, some of the things we are saying are so powerful that when packaged and put forward, it will make a difference. And then we, connect with each other like that. Thank you.
Hey, amazing. I like the aspect of see each other as partners, not competitors, and we need to work together. So it's about partnerships and more partnerships. We need to work together, move together, and that way we will really go far. So thank you for that great summary, Mary. And now I will just move it over to Collins. for some perhaps comments and closing remarks. But I've really enjoyed moderating this session. Thank you to all the panelists. Thank you to all the participants for participating in the comments and just joining us. And I hope that this has been useful and we'll all go back to our homes, back to our communities and implement what we have learned here. Thank you. Over to you, Collins.
Thank you so much, Valentine Kamau. That was so informative discussion. And even without going to my closing remark, I am just happy to see different experts in the panel. And I was thinking maybe 2 or 3 will want to say hello and ask questions before we close up. So maybe if we can see a hand, we can give maybe 2 or 3 to ask a question. Do we have any who would like to ask a question? Okay, so it seems the information is home, knowledge is power, and a lot has been exhausted by our respected speakers. And I really thank you all, our speakers, the technical team behind, and also the delegates who have taken their time to come and attend this roundtable. I know we still have a lot of gaps within our institutions when it comes to wellness. We still consume a lot of digital junks, and we still suffer a lot from digital obesity. And that applies to even the actual NCDs that Dr. Catherine Karekezi has put out so well, breaking down how the relationship there how digital wellness and also NCDs links. Yeah, so this is quite informative, and just would like to invite every stakeholder which is present here today, at least to take a step. Let's have this conversation, and let's see on how we can build a digitally well institution or environment that will allow your employees to thrive and see how best they can balance their work. Let's not build a digitally environment that will give a lot of pressure within the workplaces, that will give our staff sleepless nights and spend most of their time on screen. But let's build an environment that will allow them to balance the situation, and also you'll be able to enjoy their services for the rest of the years. And as the founder and the current CEO for Youth Initiative Development Program, I would like to thank you all and welcome you to join the coalition, of which we have Albert Migoa, who is experiencing a bit of technical hitches, that is technology sometimes. But we believe that we can build this together because we are building a very vibrant and powerhouse of advisory board who can run the coalition for digital education wellness. And of course, we cannot roll all the trainings, do an advocacy alone. We really want you to be part and parcel of this process. And again, we also invite you for next year. We'll have a summit on digital, our second summit on digital education wellness. That will touch a lot on NCDs, will touch a lot on digital wellness, how the two links, and also will touch a lot on artificial intelligence. So with that few remarks, allow me to put a final word. We must commit today to ensuring that the prosperity we are building in digital age is measured, not only on GPD or GDP growth, but in the robust mental and physical health of our people. Thank you for your expertise. Thank you for your time. Thank you for your commitment. And I'm looking forward partnering with you in our webinar series coming next year from January, a long way up to May, when we will be having our in-person summit. Thank you, and may you have a blessed evening.
Thank you again very much.
Thank you, everyone.
Bye, everyone.
Let's be in touch.
Macho kwenye skrini usiku na mchana, muda wa usingizi unapotea, una maana mwili unalia, akili inachoka sana, isiyo maisha ni mzigo wa zama. Kidigitali tunazidi ku